Hi, my name is Martine, and today I want to discuss the dental needs in Mexico regarding dental caries and periodontal disease and some of the risk factors. So we know that oral disease affect many people around the world. Caries and periodontal disease is a real concern, especially in disadvantaged population. The first concern I wanted to discuss with you is caries. In the National Library of Medicine, an article titled Analysis and Evaluation of Dental Caries in Mexican Population and Descriptive Transversal Study, which was published on February 22nd, 2023, states that Mexico is among the countries with a high frequency range in oral diseases, highlighting dental caries, which affect more than 90% of the Mexican population. A study was done to determine what is causing the high caries risk. So, a cross sectional descriptive and observational study was carried out in 552 individuals in different populations using caries measurement method described by the World Health Organization. Prevalence of caries DMFT index was measured. So that index, what it measures is decay, missing, and filled teeth. And it is a way of determining and monitoring the oral health status in a community. Other aspects were also studied, such as oral habit and the use of public or private dental services. So, what were the results? It was found to be statistically related to following variables: the place of residence, socioeconomic level, gender, a level of education, and regarding for primary teeth, the prevalence of 60 of cavities was at 64%, and with adults, it was at 84%. And there was no statistical relationship with any of the other variable studies. The other studies, more than 50% of samples use private and dental services. Another cause of caries could be the food insecurities. An article that was brought out in the National Library of Medicine, which was titled Food Insecurities and Dental Caries in Rural Mexico Populations, was published on October 6, 2023. In this article, it brought out that oral disease are more frequent in low-income countries, particularly those with high poverty rates. In Mexico, 28.2% of households had moderate or severe food insecurities. Moderate to severe food insecurities was more frequent in rural areas at 35.4%. In other areas, it was at 42.4%. A low socioeconomic household at 49.9%. Food insecurities also affect elderly adults at 27.9%, and a high food insecurity level are present in individuals with depression and impaired activities of daily living at 22.6%. So we see that food insecurities is associated with dental caries, and food insecurity individuals have a higher probability of severe dental caries. So the second concern we're going to talk about today is periodontal disease in Mexico. So this information is also being taken from the National Library of Medicine. There was an article that was brought out about some of the conditions related to alcohol and tobacco use in Mexican adults. So the title of this article was National Survey of Oral Dental Conditions Related to Tobacco and Alcohol Use in Mexican Adults. This was published on March 17, 2014. It stated that dental caries and periodontal disease are as well as the possible of tooth loss are major dental public health problems worldwide. Poor oral health and untreated oral disease have a negative impact on the quality of life of individuals and their overall health. This oral disease burden is markedly higher in developing countries like Mexico. According to a Global Burden of Disease 2010 study, it shows that poor oral condition remained highly prevalent in 2010, collectively affecting 3.9 billion people. The most common and the greatest burden globally is untreated caries and permanent teeth. Global prevalence of 35% for all ages combined. Whereas severe periodontitis and untreated caries and deciduous teeth were at 6 to 10 were at the 6th and 10th most prevalent conditions, affecting respectively 11% of the global population. These diseases are equally highly prevalent and incident in Mexico across various age groups and are concentrated to those with greater social disadvantages. So what are some of the risk factors? A diet rich in simple carbohydrate, poor dietary patterns, inappropriate oral hygiene behaviors, restricted access to dental services, tobacco use, and excessive use of alcohol are some risk factors for these diseases. This article also brought out that tobacco and alcohol has considerably impact on health, being two of the most important lifestyle and addiction consideration in this area. There is considerable epidemiological evidence demonstrating the adverse effects of both tobacco and alcohol contributing to periodontal disease, tooth decay, tooth loss, staining of teeth, and dental restoration. So, in conclusion, we see there is a high need for dental treatment in the population study. It is necessary to develop prevention and treatment strategies. It is important to collaborate with projects to promote better oral health conditions in disadvantaged populations. Identify risk factors for caries is important because they are closely related to nutrition. There is a high need for dental treatment and education on oral disease in Mexico. This concludes the end of my presentation.